In November 1998, the Master Settlement Agreement was signed between tobacco companies and the Attorney General of 46 states and 5 territories. The settlement is approximately $200 billion over 25 years. At the time, Arkansas was one of only 5 states using the tobacco settlement money with an intended purpose: healthcare programs, recovery of financial healthcare costs, creating programs to curb the desire for youth to smoke, and preventing diseases related to tobacco use.
Over 100 healthcare organizations in Arkansas formed the Coalition for Healthy Arkansas Today, also known as CHART. This collaborative team developed a plan which outlined the best use of funds received from the tobacco settlement agreement. The first $100 million the state received from the settlement payments was placed in an endowment called Arkansas Health Century Trust Fund. All other settlement funds go in the Tobacco Settlement Trust Fund and are dispersed annually.
Then Governor Jim Guy Tucker had this 2-day meeting, and out of my subgroup, we talked about using the tobacco settlement money for some kind of good in the community. When we brought that to his, back to the full body, they loved it and they wind up passing a law.
In November 2000, Arkansas passed Initiated Act 1, which dedicates a portion of Arkansas's master tobacco settlement revenue to tobacco prevention and cessation. The Arkansas Department of Health has implemented a program to use these funds to reduce the use of tobacco and tobacco products in the state.
When the legislative act was passed, a percent of the funding for the program that was facilitated by the Department of Health were designed for the University of Arkansas at Pine Bluff, and that was the called 15% set-aside monies. And at that point, I was working with the program with the Arkansas legislature, and I was also employed here as Dean of the School of Education. So it was just sort of a natural to transfer from the legislature and the work that I was doing to the university.
We take the academic knowledge that we have here on the campus and apply it to a particular challenge to the community, which had to do with the health consequences of the use of tobacco.
The University of Arkansas at Pine Bluff, what we call the flagship of the Delta, was the most ideal network to actually manage and administer the set-aside program, and that program took on a name, Ms. Argo, the Minority Initiative Sub-Recipient Grant Office.
Arkansas has been recognized for its relevant and efficient use of tobacco settlement funds. The University of Arkansas at Pine Bluff, Musargo is continuing the state's positive direction by targeting community organizations that serve minority populations. The mission of UAPB's Minority Initiative Sub-Recipient Grant Office is to transform the norms of minority communities such that tobacco use is unacceptable. Since its inception, Musargo has followed the Center for Disease Control's best practices for comprehensive tobacco control programs. Through its implementation of key components for comprehensive tobacco control programs, Musargo also adheres to the goals of the National Tobacco Control Program of the CDC. Eliminate exposure to secondhand smoke, promote quitting among adults and youth, prevent initiation among youth and young adults, identify and eliminate tobacco-related disparities.
The Musargo implements the best practice component of state and community interventions through its sub-recipient program. The Musargo provides funding through the Master Tobacco Settlement Agreement to community-based organizations for tobacco prevention in minority communities.
UAPB, we carved out a portion just targeting minorities. I was in Pine Bluff. I was one of the first people to apply for a grant and one of the first grantees, and was a grantee from 1999 to 2007.
Musargo has funded over 100 organizations during its tenure, and for every dollar given, 2 are spent back in the local communities for tobacco prevention work.
The organizations that apply for the tobacco funds must follow the Centers for Disease Control's best practices in order to ensure a successful and comprehensive program for education and tobacco prevention. The number of sub-grantees for each year has ranged from 9 to 27 per year. Sub-recipients range from faith-based institutions to after-school programs, all with the task of tobacco prevention and education in minority communities.
Key communications interventions include paid television, radio, print and digital advertising geared specifically toward African American and Hispanic males ages 18 through 24. Specific campaigns featured NBA basketball player Ronnie Brewer, a former University of Arkansas Razorback.
What's up? I'm Ronnie Brewer. Look, I can't even imagine where I'd be if I had chosen to smoke, and I don't want to. Check this out. Did you know that more African Americans die from lung cancer than any other race in the United States? Or how about tobacco smoke has been found to cause health problems to almost all parts of the body? So hey, it's time to kick the habit. Call the quit line, 1-800-QUIT-NOW.
Public relations and earned media efforts are also key in Mazargo's mass reach health communication interventions. Op-ed pieces and articles were shared in local publications in key counties, those with high tobacco prevalence and high minority population. Articles were timed for release to coincide with national awareness events, such as the Great American Smokeout and World No Tobacco Day. A key part of the Mazargo Health and Promotion and sponsorship activities was the partnership with the local radio station's charity basketball team. It allowed Mazargo to have a presence in smaller communities where there would be a layering of multiple interventions. They had radio spots, information tables at the events, halftime presentations, and much more. This unique activity allowed Mazargo to reach key and specific demographic groups, which allowed the target audience to hear the message multiple times.
Although Mazargo cannot provide direct cessation services, Mazargo and its subrecipients partner with local entities to link individuals to cessation services. Promotion of the state's helpline is instrumental when working in local communities.
Thank you for calling the Quit Line. This is Marcus. I'm so glad you're ready to quit smoking.
Hey man, how much is it going to cost?
The Quit Line is free. We provide everything you need to kick the habit.
Stamp out smoking. Smoking causes more complications than you think. Call it quits today. 1-800-QUIT-NOW.
Mazargo provides oversight to the community-based organizations through fiscal and program monitoring. Mazargo also participated in the evaluation of its efforts through an external evaluation team, Fetterman and Associates.
Folks contacted me about maybe using these kinds of techniques, these evaluation techniques that are more positive and constructive than other techniques, to use it towards tobacco prevention, particularly in minority communities. So we started working together using something I call empowerment evaluation to help people learn how to self-assess and towards helping people reach their goals using evaluation feedback.
Mazargo continues to base its work off of the Center for Disease Control's best practices to reduce the burden of tobacco in minority communities. Mazargo uses 7 key strategies for implementation: request for proposal, mini program support, capacity building workshops, community resource, clearing the air in communities of color conference, media campaign, and program oversight. Every 2 years, Mazargo releases a request for proposals for local and community programs to implement tobacco prevention and education work in their local community. Organizations are required to implement tobacco prevention programs promoting social change among minority communities, and to pursue policy initiatives that protect the public from exposure to secondhand smoke, reduce youth access to tobacco, and decrease tobacco advertising.
I'm a bad influence, you want a hit of the cigarette, better use common sense. Detail, new song, same type of those who thinking about trying. Stop it. Promise, what's this? That the last hit was your last hit.
I promise, I quit.
What? I'm through, that's it.
In 2009, at the recommendation of an advisory committee member, Ms. Ergo instituted the Mini Program Support, or Mini Grants. These grants are a small one-time award to organizations for small tobacco prevention projects. The mini grants are designed to build capacity among local community groups to increase the tobacco prevention message at the local level.
Our subgrantees and Ms. Argo work very hard to bring awareness and to also help to change behavior. We have seen a decline in rates as far as minority males are concerned, which we have worked in for the last few years specifically.
We do receive a grant to operate in about 8 counties under the Ms. Argo umbrella, providing program, information, technical support, and gaining policies in communities of color. Ms. Argo, under the Ms. Argo grant, we're able to focus on an aspect of policies that has been overlooked or missed by the general population.
Capacity building workshops are designed to build capacity among individuals and organizations at the local level. These workshops are a key strategy in the sustainability of Ms. Ergo and its efforts at the local level. Key workshops include organizational development, grant writing, inside the tobacco industry documents, tobacco prevention in the African American church, using evaluation to inform policy, empowerment evaluation, practical program evaluation, a program theory approach, the use of technology in evaluation, interviewing, 40 Days to Freedom, and outing tobacco.
Ms. Argo serves as a community resource through presentations, health fairs, and other outreach areas. Ms. Argo provides information and an opportunity for communities to hear about tobacco use and the impact it has on minority communities. Recently, Ms. Argo worked with local churches to create policies for tobacco-free church campuses.
And Ms. Argo has been able to leverage that thought pattern to involve clergy and taking the lead and leading their parishioners to smoke-free lifestyles through the adoption of smoke-free church campus policies, talking about the harms of smoking and tobacco usage from the pulpit.
For the past 16 years, Ms. Ergo has held the annual Clearing the Air in Communities of Color Conference. It is the only conference that focuses on specifically increasing knowledge and improving skills as it relates to tobacco prevention in minority communities. The goals of the conference are: provide practical skills and comprehensive information for individuals involved in tobacco prevention and education in minority communities. Promote the exchange of innovative programs and practices among individuals who are dedicated to eliminating the disparities among different population groups. Improve multidisciplinary interaction and collaboration among professionals in tobacco prevention and education. This annual event provides an opportunity for advocates in tobacco prevention and education to receive and provide information for comprehensive public health efforts. Advocates use this event as an opportunity to form collaborative networks to assist in informing Arkansans about the dangers of tobacco use in minority populations.
Ms. Argo currently monitors trends and new information regarding tobacco prevention, policies, and products. Ms. Argo provides direction to subgrantees and other community advocates on where to focus their efforts.
To date, Ms. Argo has awarded over 100 organizations for tobacco prevention efforts in minority communities, totaling over $10 million. Since its inception, Ms. Argo has placed tobacco settlement funding back into 80% of Arkansas's counties for tobacco prevention and education in minority communities through organizational funding, community workshops, and/or health communication initiatives. Currently, there are 10 programs that are funded by Ms. Argo for tobacco prevention and education efforts in minority communities. The programs cover 48 counties in the state.
University of Arkansas at Pine Bluff, was the first to implement a tobacco-free campus due to a collaborative partnership formed between the Minority Initiative Subrecipient Grant Office and the Coalition for Tobacco-Free Arkansas. Family Youth Enrichment Network, a sub-grantee of the Minority Initiative Subrecipient Grant Office, petitioned for smoke-free parks in Helena, West Helena, and was successful. Now, there are over 25 parks and smoke-free events because of the Mazargo sub-grantee efforts. The Minority Initiative Subrecipient Grant Office partnered with the local fire department to bring awareness to the other side of prevention related to tobacco use and fire safety in minority communities. Future Builders Incorporated was successful in getting Act 811 of 2011 and the Arkansas Driver's Educational Manual. And Family Youth Enrichment Network worked with city officials and county officials to raise the age to purchase tobacco products to 21 in Helena, West Helena, and in unincorporated towns in Phillips County. At the time, Mazargo was responsible for 18 full-time equivalent positions around the state. On average, for every $1 million Mazargo received each year, the economic impact in local communities more than doubled each year. This still holds true. This is through direct and indirect methods. The total economic impact for the time span was $23,935,498.
Start reporting people more. We've kind of slacked up on there. When I was a grantee, we would do surprise visits and report people. And I think that needs to be going more. Also, just expand it. I think we need to be like the West and have smoke-free parks.
So I do hope that it will be continuously funded through the Master Tobacco Settlement funding, and should those funds disappear, through funding from the taxpayers of the state of Arkansas. So longevity is one of the things that I would like to see. From the standpoint of what is it that I'd like to see the Mazargo staff do, I would like to see them put a little more emphasis on researching and publicizing what they are doing. And that's why I'm glad they're doing this video.
One place I would love us to go, retention of staff. The other place is for Ms. Argo to be recognized for the program that it is, that to have its own autonomy. We know that funds are administered and channeled through to the school being UAPB, and then on to Ms. Argo through the Arkansas Department of Health. But we have individuals that are so seasoned, so experienced, that having autonomy so that they can manage their programs as it needs to be.
Our program and our sub-grantees will have to just stay on top of the new emerging products. We have a particularly high influx of electronic cigarettes being used in our communities now, particularly among our youth. And so what I would like to see the program do is to reinvent, reinvest, and kind of reevaluate how we are focusing when we are doing our tobacco prevention work, particularly as it is concerned to electronic cigarettes.
Mazargo has worked to change social norms in minority communities regarding tobacco. With new and emerging trends, Mazargo will continue to bring awareness to the nefarious effects of products such as Juul and other e-cigarettes. The work must continue.